Hello everyone, I'm Dr. Shreyas, Consultant Radiation Oncology, Medicover Cancer Institute, Nellore. Today I'll be talking about cervical cancer screening and prevention. Cervical cancer, which is also known as carcinoma of the cervix, is the second most common cancer in Indian women. The most common causative organism for cervical cancer is a virus called as human papilloma virus. We call it the HPV. HPV generally enters the body through cervical route. Most of the women can combat the virus, but a few who have multiple sexual partners, repeated pelvic infection, multiple pregnancies, HIV, and other immunocompromised conditions proceed to precancerous and cancerous lesions. From the time for infection to convert into cancer, it's quite a long time, that is 10 to 15 years. So screening for cervical cancer can be early detection for these precancerous and cancerous conditions. Screening for cervical cancer, there are two basic modalities. One is the pap smear. The pap smear is nothing but testing or taking a smear from the cervix through the vagina and testing it for the cells, which can be normal or atypical cells. Pap smear can be started at the age group of 21 years and it can be continued for every 3 years until 65 years, when all the reports previously are normal, and it can be stopped at 65 years. The other modality of testing is the HPV DNA testing. HPV is the causative organism and testing it, but that can be done only after the age of 30 years. And it cannot be done alone. You have to add on pap smear with HPV DNA testing. And if you choose to do both the testings, then HPV DNA and pap smear should be done every 5 years after the age of 30. So basically, from 21 years to 30 years, you have to do pap smear at every third year. And after that, if you want to opt for pap smear alone, then it has to be done every 3 years. And if you opt for pap smear and HPV DNA, it can be done every 5 years and can be stopped at the age of 65 if the previous reports are normal. For the people who have undergone surgery, that is removal of uterus and cervix, because of non-cancerous conditions, they can stop the screening program. And for patients who have undergone surgery because of precancerous and cancerous lesions, they have to continue the screening programs. Prevention when it comes to cervical cancers, basically I'm talking about the vaccines. Yes, the vaccine is against the causative organ, that is called as HPV. So it's the HPV vaccines which are available. It can be bivalent, quadrivalent or monovalent. Generally, it will fight any new HPV infections which will be coming into the body. So it can be given from the age group of 9 years to 26 years. Some places they give up to 40 years. As I already told you, they will fight against the new HPV infection if at all it is going to come. So basically, to summarize, by active screening, which I already told you, like pap smear and HPV DNA testing, and prevention by cervical vaccine, we can reduce the incidence of cervical cancer in the world. So I hope this video was informative. Thank you and have a nice life.